247 Aphorism Organon of Medicine. Under these conditions, the smallest doses of the best selected homeopathic medicine may be repeated with the best, often with incredible results, at intervals of 14, 12, 10, 8, 7 days, and where rapidity is required in chronic diseases resembling a case of acute disease at still shorter intervals, but in acute diseases at very much shorter periods, every 24, 12, 8, 4 hours, in the very acutest very every hour, up to as often as every 5 minutes, in every case in proportion to the more or less rapid course of the disease and of the action of the medicine employed, as is more distinctly explained in the last note. Aphorism 247 is rewritten in the sixth edition as follows. It is impractical to repeat the same unchanged dose of a remedy once, not to mention its frequent repetition and at short intervals in order not to delay the cure. The vital principle does not accept such unchanged doses without resistance, that is, without other symptoms of the medicine to manifest themselves than those similar to the disease to be cured, because the former dose has already accomplished the expected change in the vital principle, and the second dynamically wholly similar unchanged dose of the same medicine no longer finds therefore the same conditions of the vital force. The patient may indeed be made sick in another way by receiving other such unchanged doses, even sicker than he was, for now only those symptoms of the given remedy remain active which were not homeopathic to the original disease. Hence, no step towards cure can follow, only a true aggravation of the condition of the patient. But if the succeeding dose is changed slightly every time, namely potentized somewhat higher, aphorism 269 to 270, then the vital principle may be altered without difficulty by the same medicine, the sensation of natural disease diminishing, and thus the cure brought nearer. Footnote: we ought not even with the best chosen homeopathic medicine, for instance one pellet of the same potency that was beneficial at first, to let the patient have a second or third dose taken dry. In the same way, if the medicine was dissolved in water and the first dose proved beneficial, a second or third and even smaller doses from the bottle standing undisturbed even in the interval of a few days would prove no longer beneficial, even though the original preparation had been potentized with 10 successions, or as I suggested later, with but 2 successions, in order to remove this disadvantage, and this according to above reasons. But through modification of every dose in its dynamization degree, as I herewith teach, there exists no offense, even if the dose be repeated more frequently, even if the medicine be ever so highly potentized with ever so many successions. It almost seems as if the best selected homeopathic remedy could best extract the morbid disorder from the vital force, and in chronic diseases to extinguish the same only if applied in several different forms.